Hi, I'm Brooks Brown, Principal of Beltway Medical in Washington, D.C. area. My elevator pitch for using a Aiken staple is, would you like to use some fixation that won't be there for an Aiken? I mean, you're already probably using a screw or a staple, but I have something that you wouldn't have to remove or won't cause the patient any pain and doesn't have any reaction. Do you think we can throw that in the next time you do a Lapidus procedure, and we'll just try this out? Typically, if you're doing any bunion procedure, you should be prepared for hammer toes and an Aiken. If you're doing a fusion procedure, you should be prepared for an Aiken and hammer toes. So any case anyone on our team goes to, we would like for them to have an Aiken staple prepared, which in this situation would typically be osseo, or hammer toes, because if they're working on the forefoot, they might not tell you before the procedure, or they might not tell you until you get to the scrub sink that you're going to need some forefoot fixation, but you should have it for any type of case. The great thing is, like, Aikens heal. By having a value add in this situation of something that will not show up and won't be there and they wouldn't have to take out at a later date, or if something goes wrong, they can just cut through it. It's a significant advantage to the surgeon, and so if they're in a hospital setting, it is a very easy switch and something that's beneficial to them and the patient. The reason that Aikens are a great place to start is it's not a procedure where surgeons are going to have a lot of nerves, and they're going to be willing to try out a new product, and this platform will be accepted. It's like, oh, well, I can try this on an Aiken because Aikens normally heal, whereas if you're trying to use a 4 or 5 nail and maybe a more midfoot or rear foot procedure, or staples in a rear foot procedure, the surgeon's going to have a little bit more pause of trying something new. So it would probably be the best place to jump off for the platform technology for them to try it out. This has a advantage. You get to give something to the surgeon that's different than anyone else in the marketplace, that probably has a value to the patient. So you should feel confident in that. When you talk to them, you are presenting them with something that could produce better outcomes, which is the goal, should be the goal as the rep and for the surgeon. Like, whenever we go into the operating room, there is a patient on the table, and we want them to go home and be in less pain and have a better outcome when they go back to their normal lives.